Hi everybody, I'm Dr. J. Burness. Because of COVID, I've been getting a lot of requests lately for people trying to do or wanting to do the work that we do online over platforms like Zoom or whatever. So I got another request this morning, and I thought I would just go over it and try and explain the situation with regards to online or virtual type work. So the email says, "Hi Dr. J, I'm trying to get help for my many PCS symptoms. I live in blank," she lives far away, "but I am wondering, would treatment have to be offered in person or would virtual work as well? I am in need of strengthening the inhibition of my sympathetic system. Can you tell me a bit about the exercises you use to help this, i.e. for light and sound sensitivity? Thank you, I appreciate your time." So again, I get a lot of these types of emails, especially these days. And I would really like it if we could actually do this work virtually, so I could help even more people. But the reality of it is it doesn't translate well to treatment in terms of the type of work that we do. So, for example, this particular person feels that she is overly sympathetic and she's looking for help to inhibit those things. And there's lots of things that we can do to try and do that. And the way that the work works here is I would basically examine this person and find the areas of the brain or the pathways involved in the brain that are not functioning properly, which has resulted in some loss of inhibition of the sympathetics. So you find those injured areas and pathways, and then the basic treatment protocol is to try and make those areas stronger. And so we stimulate those areas, and sometimes you can do it directly. A lot of times the areas are too weak and you have to do it indirectly. And I basically use three types of modalities when I'm working with a patient. We'll do things that are passive, where we're actively stimulating the patient while they're just sitting there. We'll do things that are reflexive, activities that the patient doesn't have to think about. These are normal reflexes, sometimes visual, sometimes somatic. We'll use those as well, again, to hit the same areas of the brain. And then a lot of volitional activities as well, eye movements, combined eye-head movements, sound localizations, things like that. So there's lots of different things we can try. And with every patient, I sort of have, after I've examined them and put together a treatment plan based on what I'm finding, I have a whole list of things that I think, hey, might work to try and stimulate these particular areas. And then what we have to do in treatment is we have to try them, because the reality is that some of them will not work at all. Some of them will make the patient feel worse, and some of them will actually be helpful. So we have to figure out which are which. And the way a treatment session would go is this patient would be sitting in front of me, and again, say for example, she's having some sympathetic overactivity. So say her right-sided midbrain is overactive or is fatiguing early or something. So if I'm going to target that right midbrain, I might try something initially with this person, maybe a pursuit down to the right, which would use some nuclei in that particular area of the brainstem. And if that is an activity that she can do, then what we're going to find with her is that, yeah, she can do some of those, but if you do a certain number, then she'll start to fail. And the whole trick of the work that I do is to push that injured area of the brain hard enough to give it some exercise, but not push it to the point of fatigue. And if you push it to the point of fatigue, the people don't get better. So you sort of have to find where that threshold is, how much activity you can do with that person before they start to fail. And in the case of something like this, where we're talking about a loss of sympathetic inhibition, I will look for signs of sympathetic activity when we're trying to do that work as a sign of fatigue. So I like to monitor heart rate, for example. Normally when you're doing these stimulations, if the person is strong, the heart rate will actually decrease. But as they start to fail, you'll see the heart rate starts to go up. Or in this case as well, we could look at our pupil diameters. The pupils might be normal when we start, but as they start to fatigue, you'll see the pupils will start to dilate as they become more sympathetic. And then the other thing that can happen, of course, is their ability to follow that target down to the right might start to fail. At any rate, so we look for that failure point, whether it's 5, 6, 7 repetitions or whatever, but that's where you stop, right? You don't want to push past that point. And so I need to be able to see pupils, I need to be able to measure heart rates and galvanic skin responses, see do their palms start to sweat. There's lots of stuff that sort of has to be done in person, and you really can't get that information through a webcam or a microphone. So in that respect, I think if we were trying to do that online or via Zoom or whatever, I think that would be a compromise of the quality of the care that person might need. And the other thing is that, these treatment sessions, ideally as you're going through the process, you should see that the person can go further and further in terms of repetitions or activities without fatiguing as they're getting stronger, and that's really what we're looking for. And sometimes that happens, certainly, and you'll continue on that road, but sometimes the person will stop getting better, and you might think, oh, now we need to do something different. So even though I've got that whole treatment plan laid out of what I would want to try with this person or what I think might work, the actual treatment sessions, they evolve as you go along, they change, and a lot of time it's kind of fly by the seat of your pants. We'll see, okay, this was working yesterday, today it's not working so well, or today she has no trouble with it all, we need to move on to something else. So quite often the actual treatment being offered, although they're all directed at the same area of the brain, the treatments themselves will change. So again, not really amenable to virtual or through a webcam or a microphone. So I hope that answers that question for this person who contacted me this morning, and also for anybody else out there who's wondering, can you do this long distance or virtually? I have many patients that come great distances to see me, and they'll stay in local hotels. These days it's mostly Airbnbs that they're getting, and I might work with them every day, a couple times a day for a few weeks, usually 2 weeks, and then I'll send them home for a while with some exercises, and if there's any issues they can come back and we'll continue. But I typically work in 12 session blocks, and I would expect a certain amount of improvement by then. And if I'm seeing that, then it's worth continuing. If we're not seeing any improvement after 12 sessions, be that 12 sessions in 1 week or 12 sessions over the course of a month, regardless, you should see improvement. If we're not seeing improvement, then I'm just going to say, hey, I can't help you, I'm sorry, try something different. But most of the time, I'm happy to say most people are improving after the first 12 sessions and will continue. And then there's that rare person, maybe 1 in 10, who is perfectly fine again after that first 12 sessions, and we can stop altogether. But again, the way I work, in person is best, and I think most of my colleagues would say the same. All right, so thanks for watching. I hope that's been helpful. I'm Dr. Jay Burness, and again, just like this person did, if you'd like to ask me any questions, if you want to contact me through my website. There's a little dialog box on the site for Ask Dr. J. I'm happy to try and answer any questions you have. All right, thanks for watching.